Welcome everyone to another episode of A Sister and Her Mister. Today we have Trina. She is the international best-selling author of Beauty's Dirty Secrets, and she creates non-toxic, chemical-free, immune-friendly personal care products. Her food-based skincare products have been featured on ABC, NBC, CBS, and Fox. She's dedicated to helping others realize the dangers in everyday cosmetics and skincare and spreading awareness for the importance of using plant-based nutritional skincare.
Doctor said you got PCOS. Now go on, girl, just lose some weight. Till I took the symptoms into my own hands and reversed them naturally. So I became a dietitian to help my sisters feel the best they've ever felt. Take a step in my direction if you wanna prove them wrong and take control of yourself. Join a sister and a mister.
Welcome, Trina. Welcome to A Sister and Her Mister podcast. We're very happy to have you here today.
Oh, I'm super excited to be mouthing off with you guys today.
Yes, we'll be talking a lot about dental health as well as skincare products. But want to ask you first, what was your inspiration or motivation to create your company, Primal Life Organics?
The company, that's a great question. And this is a pain point for a lot of women. I got pregnant when I was turning 40, and I was just ecstatic. Anybody that's, older or trying to get pregnant, had a difficulty getting pregnant, you know what that's like. And then at 7 weeks, I miscarried. And sorry
to hear that.
Thank you. It's really the reason I started this company. So something really good turned out because of it. But it was at that point, my husband and I were healthy. At that point we were eating healthy and, exercising, all sorts of, good things. But I knew that if there was something in my life I could change that might change the outcome. If I got pregnant again, I needed to do that. So I just started looking at my environment. We changed our laundry detergent. We changed our cleaning supplies. Never dawned on me that my personal care products were a source of toxins that can cause, problems with your hormones, which affects, your ability to, have a baby or not baby, and even for men, it affects that as well. So anyway, to make a long story short, I got pregnant again pretty quickly. I was at 7 weeks, the same spot that I had miscarried. And I started looking at my skincare one morning. I was getting ready for work. I glanced down at my moisturizer. It was from a company that, said they were natural and organic. This was back in 2007. So it was a while ago. And I looked at the ingredients probably for the first time with a, more keen eye. Mm-hmm. And I realized that there were toxins in there. So totally. And I knew that those toxins crossed the placenta. And here I am at week 7, and I just want to get past week 7. If I can get past week 7, there's a possibility this baby will make it. So I ditched everything from that moment. I ditched all my personal care products. I ditched my makeup. I ditched everything I could think of, because as I was starting to open my eyes and read all the ingredients, all the labels, I realized that there were toxins in just about everything. So I started just putting natural ingredients, oils. I started blending oils and making oils and essential oil mixes. And lo and behold, my skin started to look better than it ever had. And I realized how flooded our personal care products are with toxins. So that's really how I started my company. I started making things, and they worked so well. I was giving them to family and friends. And then my daughter was born healthy, thank goodness, full-term healthy. And I said to my husband, I should just sell this stuff. And I was thinking about a little store on Etsy, and lo and behold, it became something that other people, men and women, were looking for. So that's how Primal Life started.
That's incredible. I love your story and your passion behind it.
Yeah. It's always the most passionate people that create the best products. And we're definitely in the same boat as you, whereas we always look for products that have either no toxins or the least amount of toxins possible. Of course, it's really hard sometimes, but we feel like more and more these days it's becoming more available. I'm curious, what were some of the toxins that initially when you started looking into it that jumped right at you, in terms of wow, is that really in my products?
The number one thing, but there's a couple as far as skincare goes. Fragrance is one of them that you can see in a lot of products. And fragrance is really just a toxic soup. You can never know what makes up a fragrance. Fragrance is a trade secret, but there's approximately 3,500 chemicals that companies can go to make their fragrance. And it's a trade secret. They don't have to disclose which chemicals they use, but most of those chemicals are neurotoxins. They cross through the placenta to babies. They cause cancer. They cause problems with your thyroid. They cause allergies and all sorts of things. They're just really bad.
Yeah.
Fragrance is probably one of the worst, but even worse than fragrance is an ingredient that most people, when they read their ingredient labels, will see on almost every product and pass over it thinking that it's okay. And that ingredient is water.
Water?
Yes.
No way. Oh my God.
What?
No, don't do this to me.
Water. Sorry. There it is.
Why?
So there's two reasons. Water in skincare is typically tap water. And I call it crap water. And tap water is loaded. You guys are healthy and you're looking for products when you're talking about natural or healthy products, you're looking for products that don't contain any kind of anything that's going to alter your neurological system or cause problems with your hormones, right? Even natural products. If water is listed, water is contaminated with a lot of things, including medical waste or drug waste. Heavy metals is another component of tap water. So when you're slathering things on your skin, and almost everything has water in it, your moisturizers, your face moisturizers, body moisturizers, soap, everything has water in it, deodorants and things like that. As you're putting it on your body, not only does tap water have heavy metals, but the top drugs found in tap water include birth control, anti-anxiety medications,
I've heard this.
antidepressants, thyroid medications, antibiotics. And these are all consistent with disrupting your hormones and causing issues internally that we just blow off and think there's other causes. So the fact that we're putting so many products on our skin that contain water, that contain these things in them that we don't expect to be in them, that's the main reason that water is so toxic in your skincare. The other reason is that most of the time, especially, as we get older, we're buying products to help us feel younger and look younger on the outside. And it's so frustrating when you buy products, they're marketed to make you look younger and feel younger, and your skin will get that glow. And when you realize it's really a marketing ploy and that the ingredients in there actually cause premature aging, if water is listed as the first ingredient, it's causing premature aging. It's actually accelerating the look of your skin, primarily because water doesn't get absorbed into your skin. Water evaporates off your skin and it disrupts your natural sebum. Your natural sebum is your body's protective mechanism to keep the oils and the hydration, the moisture level inside your skin. If you disrupt that, the good microbiome gets disrupted. So people end up with acne and psoriasis and skin conditions that they don't realize they're creating by the products they're putting on their skin. But also the fact that it's pulling the moisture that barrier is not there, and the moisture from inside the skin is lost. And then all of a sudden your skin's extremely dehydrated, and dehydrated skin is going to look a lot older. It's not going to be able to detoxify, or even it's going to look very thin and sallow. So one of the quickest ways to, I say, take a couple years off your face is to just start using an oil-based skincare. So that's why, in my opinion, water is actually the worst ingredient. On top of that, when you use water in skincare or any products, you have to add other ingredients to make it okay. You have to have preservatives because there's bacteria in water as well. You have to have emulsifiers. You have to have thickening agents, all sorts of types of ingredients that are typically used. The ones that are commonly used in skincare are all toxic. So that's the other reason. If you omit water, like my products, when I create products for Primal Life, my products are all oil-based, and oil is its own, it's antimicrobial, antibacterial, antiviral. I don't need to use preservatives because oil is already a preservative itself. So I don't need all those other ingredients. What you end up getting is a component or a product that is all active and is going to do what you want it to do without damaging your skin and the inside.
So what about our showers and like the water we wash our face with? This is all tap water. Like, how do we protect ourselves from toxins in that?
I know I get that question a lot, and you can buy shower filters. I always tell people, it is an exposure risk because tap water is contaminated with a lot of things. You can get whole house filtration systems if you can't get that for your house. Typically, I recommend looking into shower heads. They have filtrations, that you attach to your shower that will help to reduce your exposure. Of course, you're never going to be in a position where you're not exposed, but limiting the amount of exposure is always important. The less you expose your body to, the better it can function to actually keep you healthy and get rid of the toxins. Part of the problem today is we're so overexposed to everything that our body can no longer function to get rid of it. It can't keep up with the toxic exposures. So by limiting what you expose yourself to, then your body will be able to work more efficiently at getting rid of anything that you're exposed to as it's happening.
Yeah, I mean, I never even thought about the shower. I think that's a really good point.
Mm-hmm.
I'm just so surprised right now because like when I look for like, for example, like hair gel, I always look for water-based pomade or things like that, just to kind of think. I mean, my thought is, okay, they're probably using filtered water or some sort of water that's been cleansed or something. But I guess if you're using just straight up tap water and you don't know where the source exactly is, it can have contaminants. So that makes sense.
Yeah. And there are some companies that do use filtered water, and it will say on there if it's purified or filtered.
Oh, it does.
Some of them will. Yeah, most of them will. If they're using a filtered or some sort of purified water, they will put it on there. If it says water, you can pretty much assume that it's just plain tap water on a product.
Okay.
There are some types of products that will always have water in them just because that's the type of product that they are. But as far as like moisturizers and things like that, your body doesn't need water, and it's actually causing, you to lose moisture inside your skin. You're actually dehydrating your skin. So I usually tell people, when you're making the switching over to a water-free oil-based moisturizers, either for your face and body, that's probably one of the best things that you can do.
That's awesome to know. Thank you.
That's really good.
What about when women struggle with cystic acne? A lot of women with PCOS have a lot of inflammation that kind of triggers, like along with having high testosterone, triggers this inflamed cystic acne that you can basically only treat through diet changes. But of course, having the proper skincare routine will complement that and make your skin much more resistant to it. So do you have any recommendations for that?
Cystic acne is tough. And, I dealt with that when I was, younger as well. Hormones, as you touched on, a lot of times hormone and diet is the key components to helping. But making sure that your skincare isn't containing anything that's going to cause irritation to the skin and disrupt your good skin bacteria. There's a lot of information out there about dysbiosis of the gut bacteria, or inflammatory bowel, or Crohn's, or SIBO, small intestinal bacterial overgrowth. Making sure that your gut bacteria is healthy plays a huge role in how your skin looks and how your body functions. So making sure that your digestive system is healthy, that you're taking probiotics, limiting sugar, that kind of thing. But just as important as gut bacteria, and actually the start of a good, healthy gut starts inside your mouth with a healthy bacteria inside the mouth. And a lot of people don't realize, but skin conditions can be totally affected by your microbiome inside your mouth as well as on your skin. Our whole body is designed to protect us and to keep us normal. And when I say normal, I mean balanced. Products that we're using on the market, not just for skin, but dental products as well, are disrupting the bacteria levels of those two areas, as well as the gut. When you're using toothpaste that contains triclosan or harsh ingredients, and you do swallow it, even if you think you spit most of it out, you do swallow that. And there was a study that showed that triclosan, which is one of the leading ingredients that is supposed to destroy bacteria. It's an antibacterial, antimicrobial type of agent. And it does that, but it does that with overkill. It actually kills the good stuff and the bad stuff. But there was a study that showed that you do swallow it when you brush your teeth, and it causes that dysbiosis, or it kills the good bacteria in your gut as well. So when you're killing the good stuff inside your mouth and you're only swallowing bad bacteria, that plays a key component role in inflammation inside the body. So I know one of the things that you really want to do, and with PCOS and any type of disease or condition, is reduce inflammation. until you can reduce inflammation in the body, you're going to struggle with the symptoms of inflammation. And acne and cystic acne and, dysbiosis of the gut and all those other things are symptoms of a bigger problem that we need to find the root cause for.
Mm-hmm. Did you hear about that sister who took Ovasitol and finally got her period after a year of not having one?
Incredible. I see those kinds of messages on Instagram a lot. How does that even happen?
Well, Ovasitol helps with healing insulin resistance, a common root issue that most PCOS sisters have. And by targeting insulin resistance, we're seeing sisters kick those crazy cravings, finally regulate their periods, ovulate, and improve their egg quality. Each packet of Ovasitol has a 40-to-1 ratio of myo-inositol and D-chiroinositol. This ratio is similar to the ratio that should be found in the body, but with women like me who have PCOS, this ratio is often imbalanced. So, taking Ovasitol can be super effective in treating insulin resistance, starting from the root of the issue.
So awesome. It tastes like nothing, so just warn me when you put it in a cup so I don't drink it.
You got it, boo. Check out the link in the description to get 15% off your order.
Talking about oral health, what are some of the ingredients that you look out for in oral health products like toothpaste? And I know for one that people talk a lot about like fluoride, which for me, like Tallene has made the switch to xylitol toothpaste. For me, it's been a little bit hard to make the switch out of fluoride because I just like maybe I've been brainwashed too much to think that fluoride is really beneficial. But like, what are some things that you look out for oral health products?
So I'll challenge you on that. I'll try and get you to understand what fluoride's doing to your body.
Please.
Okay, fluoride. I don't even know where to start with fluoride. I don't want to get too deep into fluoride, only because fluoride is something that the Dental Association has really brainwashed into believing is necessary to have a healthy mouth. However, it's approximately 90% of adults have cavities, at least one cavity in their mouth. So if fluoride was actually doing what it's supposed to be doing, why do we still have cavities? And it's really because fluoride is not effective and actually causes more damage than good. And there is such a thing as having too much fluoride in your body. When you're born, you are not supposed to be born with fluoride in your body. Human beings are not supposed to have fluoride in their body at all. And when mom is pregnant, if mom has fluoride in her body, free-flowing fluoride, in her bones, in her muscles, in her bloodstream, the baby will be born with fluoride in their body as well. Fluoride is a neurotoxin. It disrupts the neural pathways as well as other issues. It can replace the real minerals that are supposed to be in your bones. It can replace calcium and phos. And fluoride it's not healthy for us when it's inside our body. It doesn't really effectively prevent cavities either. It puts a little bit of a coating on the teeth, but it doesn't ultimately prevent the breakdown of enamel. There's a more effective way to do that. There's a better product or a better ingredient to do that with. It's called hydroxyapatite. I don't know if you guys have heard of hydroxyapatite.
I haven't.
Hydroxyapatite is the exact same thing that is found in your teeth. Hydroxyapatite is calcium and phos, and it can now be added to dental products. We started adding it to my Dirty Mouth tooth powder and toothpaste about a year ago to increase the effectiveness of it. What they found is with hydroxyapatite, the hydroxyapatite calcium and phosphorus actually plug the holes where you've lost calcium and phos in your enamel and can rebuild the enamel. I've known this for a long time. We use clay. I use a blend of 3 clays, and then we added hydroxyapatite as well. And the blend of 3 clays also contains the minerals that your teeth need. It's really important that you replace those minerals with what you lost. So if you lost a calcium, you replace it with a calcium. If you lost a phos, you replace it with a phos. But your teeth have other minerals as well, like manganese and silica. And if you don't replace those with the correct mineral, you still have a hole there. So that's why I really like a clay-based blended with hydroxyapatite. What that's going to ultimately do for you is it's going to make your teeth stronger and cavity resistant, the way they thought fluoride was supposed to do it. But it's obvious, just with statistics alone, it's obvious that fluoride isn't doing what they expected it to do.
Yeah. And I've also heard some studies about how it can affect brain health and a lot of other negative effects on it too. I guess for me, I've never had a cavity in my life, so I'm scared that if I stopped having fluoride in my toothpaste or whatever, that I'll start getting cavities. But also I have a very low sugar diet too, so I think that's probably the reason why I haven't gotten cavities. But that's good to know.
Yes, and that's really important to understand too. Is diet plays a big role. And your saliva health is actually the component inside your body that protects your body against cavities. So internally, this is where internal health really plays a big role in your body, or the health of your mouth, is if your saliva content has high minerals, and if it's more neutral, it's not alkaline by nature, but it's more of neutral. Your saliva, as you're salivating, is supposed to wash away the sugars, neutralize the acids, kill the bacteria, and remineralize your teeth. So that's the component that's typically missing when people end up with cavities. And for you, you're probably healthy, and that's what's maintaining it for you, more than fluoride is maintaining it, you know?
Yeah, I believe you.
I completely agree. I've read that women with PCOS who have chronic inflammation and insulin resistance running rampant tend to have more cavities and more predisposition to get gingivitis, bleeding gums, gum disease. And it all like ties in together in a way that I had no idea when I was younger. I had so many cavities and constantly getting fillings, and it was just so miserable. And if I had known how it plays a role with diet and lifestyle. I mean, I didn't know a lot of things back then about PCOS management, but now I know, and I'm like adamantly flossing, super careful with everything. But, you know, the damage is done. It was done when I was younger, and now I have all of these like fillings that...
The question is, can you heal a cavity? Like, is there a natural...
Yes,
I love that question. Yes, I love that question.
Let's also talk about your light therapy for teeth.
Okay. Yeah. Because they kind of go hand in hand. Can you heal a cavity? And that's an amazing question. The answer is both yes and no. Because I get this a lot when I do posts on our social media. We talk about healing cavities, and I'll always get dental hygienists or dentists who come on and say, you can't heal a cavity. And I always tell them, you're absolutely 100% right. And you're 100% wrong. And it really depends on what you're using inside the mouth. So if you're going to use products that contain SLS, or sodium lauryl sulfate, triclosan, peroxide, alcohol-based mouthwashes, if you're using ingredients like that, the artificial colors, the artificial sweeteners, you will 100% never heal a cavity. You're actually going to be causing your own cavities and creating your own gum disease, which increases inflammation. When you were talking about the inflammation in your gums and the inflammation with PCOS, there's a direct correlation between gum health and internal health. If your gums are bleeding or inflamed, that is a direct pathway of pathogens to get into your body, because your gum tissue is highly vascular. The difference between your mouth and other areas of your body is that when it enters your vascular system inside your mouth, the blood travels throughout your body. It doesn't go directly to your liver to be cleansed and get rid of all those toxins. It goes throughout your body. It goes back to your heart and your lungs to be reoxygenated. And then from your heart, it gets pumped everywhere. That's why your mouth is directly related to brain health. It's related to fertility. It's related to thyroid. It's related to everything. In your gut, when you absorb toxins, when you ingest toxins in your gut, the body sends it to the liver to break down those toxins and get rid of it through your stool or through your urine. But in your mouth, it's absorbed direct. And this is the same thing with your skin. This is why skincare is so important to clean it up, because when it's absorbed peripherally outside of your gut, it goes everywhere throughout your body. That's why a small toxin in your toothpaste or your skincare is really, a loaded bullet. It's a loaded gun, because you don't know where that's going to go. You don't know where it's going to be the tipping point, or where it's going to stress you out, and where it's going to cause inflammation. So, yes, you can heal a cavity. The flip side of that is, so here's the problem with a lot of the products on the market. Products on the market don't contain the three things that I have found that helped your body to remineralize your teeth and heal a cavity. Instead, the products on the market are creating more acid in the mouth. The acid in the mouth wears away at your enamel. When your enamel gets thin, it is because you're losing the minerals, the calcium, the phos, the manganese, and you're not able to replace it. When your mouth is acidic, either because what you're brushing your teeth with is acidic or the foods in the drinks that you're consuming are acidic. And by the way, most of the foods we eat are acidic by nature. The meats, the drinks, the coffee, the wine, all of that stuff is acidic. So you're never going to not be, having acids in your mouth. The problem is that our mouth is now so acidic all the time that our saliva, if we go back to that, your saliva can't neutralize it. So if you're constantly in an acidic state, think about cancer. When you're constantly in an acidic state, cancer multiplies. That's the exact same thing that's happening inside your mouth. It's sort of like its own little environment. It's creating acid. The bacteria that's bad creates plaque, creates acid, wears away at your enamel, wears away at your gums, increases the diameter of all those cells so that the bad stuff can get in. Now you've got inflammation that enters your body. Your body's in this inflamed state, and you can't fix anything. The three components of healthy dental products include, has to be alkaline. If your mouth is alkaline, even if it's when you're brushing your teeth, creating an alkaline environment kills the bad bacteria. The good bacteria that's helping prevent the growth of the bad bacteria lives in an alkaline state. It will kill the bad stuff that causes gum disease, causes cavities, but it's also going to remineralize your teeth if there's minerals present. During an alkaline state in your mouth, the minerals go from wherever the minerals came from, whether it's carrots or broccoli or red meat or your toothpaste. If it's alkaline, the minerals go from whatever the outside source is back into your enamel to strengthen it. Because we live in such an acidic state with the products we're using in our diet, we are not replacing the minerals as fast as we're losing them. So our enamel gets thinner, thinner, thinner. We end up with sensitive teeth. We end up with cavities, and then so forth. So it has to be alkaline. It has to have minerals present. If it doesn't have minerals and it's not alkaline, it's not going to do you one bit of good at preventing cavities, but it can reverse cavities if those two are present. And the minerals come from either clay-based powders. So bentonite clay, French green clay, and kaolin clay are the three powders that I use in mine, along with hydroxyapatite. And then it has to detox the tissues of your mouth. Your mouth is pretty dirty by nature. You're exposed to pollutants in the air. You're exposed to, we talked about tap water, and the food is, there's heavy metals and things in the foods and the drinks that we're consuming. Those things can just harbor in your gum tissue and all of the tissues of your mouth. If you're brushing with something that has clay in it, clay is such a strong binder that it's going to help pull those toxins out of the tissue to cleanse them. So then you can reduce the inflammation. You can get rid of those bleeding gums and rebuild your gum tissue back up. And you can remineralize your teeth. So your products really need to be alkaline. I tell people, if you're brushing with something, you're not sure if it's alkaline, baking soda is the key ingredient that I suggest looking for. If it's got some baking soda in it, it's going to be alkaline. It's going to create the right condition for remineralizing your teeth and getting rid of the bad bacteria. Making sure it's got clay and or hydroxyapatite with that baking soda. And then as long as it has the clay in it, it's going to help pull those toxins out. And then that's going to be a deep cleanse. If you do that, you can definitely heal a cavity. I've had it done. Thousands of cavities have been healed. In fact, I've actually had a woman who had a tooth that needed a root canal. And when she went to get her root canal done, after using my tooth powder, the Dirty Mouth tooth powder for not even a very long period of time, she went to get the root canal fixed, and the dentist sent her home. She had 6 cavities, one that needed a root canal. He sent her home and said, "You only have 1 cavity and it's so small, you don't need anything done, go home." So She was ecstatic.
That's amazing.
That is great. I mean, just have not someone drill into your mouth and create a whole procedure in your mouth and just heal it naturally. That's an amazing approach. I mean, I think it's worth trying, at least if somebody has a cavity, to see if it's possible.
How long does it take to see results? A few months?
It just depends on the condition of your mouth. Everything comes back to the environment. And, I'll have people say, oh, I have a sensitive tooth or I have one cavity. What can I do? And I always tell them, that tooth, you have to remember that tooth is in the exact same environment with all the rest of your teeth and your gums. So if it's damaging one tooth, if that tooth is stressed out, it's stressing the rest of your mouth out. So we just really have to switch the environment, which is what I was talking about with changing what you're using. Get rid of mouthwash. Mouthwash is bad. And I usually say mouthwash in general. There's probably about 4% of the mouthwashes out there that are okay. But the rest of them, especially if it contains peroxide or alcohol, that is going to destroy the good bacteria. It's going to create acid and it's going to create the wrong environment inside your mouth. What you want to use instead is an oil base. I created a gum serum. It's an oil base, it's olive oil with 11 essential oils. Those increase blood flow, reduce inflammation, and help heal the gum tissue. The other thing you were talking about is the light therapy inside the mouth. And that is it's new. And it's really exciting because light therapy has been used for a really long time for skin health, improving collagen in the skin, reducing inflammation, especially for wound care. I'm a nurse, and using light therapy on wounds or surgical incisions really helps to heal them quickly. By putting red and blue LED light inside the mouth, it's a whole nother ballgame. Primarily because light penetrates the tissue. When you're talking about brushing your teeth, most products brush or cleanse the surface. And if you're using the wrong products, you're damaging that surface. If you're using light therapy, you can actually affect inside the tissue or the enamel, or between the teeth, if you will, or into the gum pockets, because it does penetrate. Red light therapy increases blood flow, reduces inflammation, and stimulates collagen production. And all three of those are extremely important in healing gum tissue, because gum tissue is really like I was talking about before, the way products or things that shouldn't be getting into your body that can cause inflammation or the inflammatory markers. The main portal of entry is through your gum tissue. And if you can tighten those junctures, if you can regrow your gums, if you can reduce the inflammation in your gums, then you can reduce the inflammation inside your body. And then the healing can start internally. So red light therapy is mainly for gum health. Blue light reduces bacteria that causes cavities. So Harvard did a study with blue light. This is really cool. Think about a little bacteria bug, and it has this portion to it. They discovered that the bacteria that causes cavities has this little thing in it, like I always say, like a heme molecule. People can envision this little thing inside that bacteria. When exposed to blue light, it causes that one piece to explode. So basically, it kills the bacteria that causes cavities when it's exposed to blue light. It's a certain nanometer of blue light. So imagine putting blue light in your mouth, exposing your mouth to blue light for 16 minutes. That's how long the treatment is, and killing the bacteria that causes cavities. And some of those could be places that your toothbrush would never get. And impacting. Blue light will also help whiten the surface of your teeth. It does this because that bacteria that causes cavities or plaque causes a yellowing of the tooth. So if you're getting rid of that bacteria, you're going to whiten the appearance of your teeth. But then the gel that I created to go with the system is peroxide free. It uses olive oil because olive oil is soothing and healing. So you're not going to have any pain with this system like you will with peroxide. And it contains the hydroxyapatite to remineralize the teeth. It contains the clays to help remineralize the teeth. And it also contains essential oils to help whiten the teeth as well. So ultimately what you're doing with the system is you're going to be rebuilding the enamel. And as your enamel gets thicker, so it's not an overnight success, you will notice a surface cleansing or a surface clean. So you might notice a whitening of the tooth immediately because we've gotten rid of some of the stains on the teeth. But over time, this is a therapy that you're going to see as the enamel thickens, your teeth will actually be a whiter white, and it's going to be stronger. So you're actually rebuilding or remineralizing the teeth, making your enamel thicker. The layer beneath your enamel, here's what people don't realize, is that the layer beneath your enamel is called the dentin. And the dentin has a bluish tinge or a grayish tinge to it. As we get older, as our enamel starts to wear thin, your enamel starts to become see-through. And when you're looking when you're looking in the mirror and you smile, can you tell? Yeah. So when you're looking in the mirror, what it looks like is sort of a see-through, and then you see like a grayish color or a bluish color. That's your dentin. And what happens over time, and this is how peroxide works. So peroxide, your dentin is fluid filled. And it's fluid filled for a reason. It has antimicrobial, antibacterial properties in it in case bacteria gets in there to kill it so it doesn't get into your pulp, which is the area that has the blood vessels and the nerves. But it's also fluid filled because it's got to be that cushion. Otherwise, every time you bite, you'll feel that bite and you'll feel the sensitivity. So it's a fluid filled. Peroxide works by, I say, dehydrating your dentin. It pulls fluid out of that layer of your tooth, because if it pulls the fluid out and dehydrate it, that area becomes more opaque and looks more white. So even though your tooth is see-through, there's no color left in there. So your teeth look white fast. That's also why peroxide hurts, because it's toxic to the nerves. And as it gets into the dentin and it seeps into your pulp, you start to feel it. So peroxide's not good for your enamel. It's not good for your bacteria. It's not good for your dentin. It actually weakens the infrastructure of your tooth and can cause tooth fractures or other issues inside the tooth.
Yeah,
Everyone's telling me to swish hydrogen peroxide.
yeah, I was going to say that too. Everyone says to switch hydrogen peroxide, it'll help whiten your
hurts.
teeth, et cetera, et cetera.
Yeah.
But I mean, there you go. That's one reason to avoid it. And it makes sense that like older people, as they get older, that appearance happens to them where their teeth become more opaque or a little bit more transparent. Because I guess over time, it just starts wearing down, and more you see that layer that you're calling the dentin.
The dentin, yeah. But the good news is, you can change that. And if you remineralize your enamel, I have got a system that I put together for the dental care, your daily dental care. It's called my dental detox kit, where you get 60 days worth of the supplies that you need to brush your teeth and, help with your gum care. You get a tongue scraper, all those types of things in it. But then the teeth whitening system will help rebuild your enamel and help your gum tissue so that you can get those results faster. But the thicker your enamel, the whiter your teeth are going to be and the better your dentist visits are going to be. You're not going to be in the chair getting the, cavities filled and things like that. You're not going to have the sensitivities. It's definitely beneficial. And the peroxide itself is so damaging. The other part of it is, if anybody has amalgam fillings still, or the mercury fillings, peroxide vaporizes mercury. And so you end up inhaling, or your body absorbing mercury in places it shouldn't, instead of, it staying in your tooth. That's the other problem. Anyone that has any kind of silver fillings or mercury fillings left in their body, or in their teeth, they should not be using any kind of peroxide in their mouth. But nobody knows that.
Yeah,
nobody knows that.
I feel like this industry, like the dental health or oral health industry, it is an industry and it is a business. So like sometimes when you think about like, why are there all these products like acid base or things that like a peroxide base? I mean, to a certain extent, like it keeps, the dentist business going or growing to a certain point. Like they get more business. There's of course lobbying. It's cheaper to make products with some of these toxins. Like it's just, I'm sure for a lot of people it's overwhelming, because a lot of like everything we talked about may be shocking, because we've all been told that peroxide is good or water-based products are good. But as far as for oral health, like what would be the first thing, like if you would recommend people to switch to something for oral health, what would be the first thing you would recommend? Would it be like the toothpaste or mouthwash, or what would you recommend?
Well, I would recommend starting with my dental detox kit, to be honest with you, because it has everything that you need. So it's going to have a morning and nighttime tooth powder. I typically recommend people switch to a tooth powder initially, primarily because it has no liquid in it. So it's all the concentrated minerals. And if you want to get the best bang for your buck and the fastest results, the tooth powder is incredible. And it's not going to foam. And most people realize that after they've switched to something that doesn't foam in their mouth, they can never go back to something that causes foaming. It leaves you feeling so clean and so fresh, like you left the dentist but didn't absorb the toxins. That's exactly how it feels. It's a win-win for you, and it's a win-win in the long term. Most dentists don't understand this type of thing. So we have to remember, most dentists are in the business because of cavities. They fill, drill, and bill. And a lot of them don't understand, or they're afraid that if we don't have cavities to fill, we aren't going to have a job, which is not true. I'm trying to change that mindset. But as a consumer, you have a right to understand that you don't have to deal with cavities. You don't have to use the products that are being promoted by the dental industry out of fear. that you will get cavities if you don't use them. I've had so many people make the switch, and they end up getting the best checkups of their life. They go in, they have great checkups, their gums look healthy, their teeth are healthy. And the dentist will say, this is the best checkup. I've never seen your mouth look so healthy. What are you using? And they tell them, and the dentist goes, oh, you can't use that. You have to use this. And so you have to understand that if you're not seeing a holistic or biological dentist, your dentist may not understand this. So you have to know what you're doing and what you're using, which is where I come in, trying to educate people on the fact that there are safe and better alternatives out there than what the dental industry, I call it big dental. You've got big food, you've got big Cosmo, you've got big farm. Now you have big dental. And, you just have to be the wise consumer who questions everything nowadays.
Absolutely.
And be willing to have an open mind. And whether you make the change today or you don't, at least you're exposing yourself to the alternative so that someday if you're ready to make the change, you know that there's an option out there. So switching to something, I usually say ditch the mouthwash and switch to an oil-based type of gum serum, as well as a toothpaste or powder that has hydroxyapatite, has clay, has baking soda in it. Then, if you want a better effect and if you have issues with your gums, using red and blue LED light therapy inside is only going to benefit you, as well as changing your dental products.
I can't wait to give it a try.
Yeah. We're definitely going to give it a try. We're going to switch over and try it out and see how it goes. But for anyone who's interested in the dental kit and as far as all your products, where is the website they can go to?
PrimalLifeOrganics.com is the website. And then I can give you guys the links if anyone's interested, where they can actually save. I put it together for promotional for you guys that they can actually, the LED, you save 60% off the teeth whitening kit, and you can actually get the dental kit with that as well. But if you're just interested in the dental kit, I can get you the website where they can go for that as well at a reduced price.
Yeah, that'd be great. Yeah, please send it to us and then we'll include it in the podcast description. So for anyone who's interested, just check out the description of this episode and you'll find those links to get started.
Awesome.
Thanks so much for joining us. We are so happy that you came on, Trina. We learned so much.
Yeah.
And I'm going to go home and change my dental routine.
Yes, 100%.
I know. I can't wait to hear your results. So keep me posted.
For sure. Maybe we'll have a follow-up episode to talk about it.
Totally. I would love that.
Awesome. Well, thank you everyone for listening. We'll talk to you next week. And until then, take care.
Bye. If you enjoyed listening to this podcast, you have to come check out The Sisterhood. It's my monthly membership site where sisters just like you are learning how to move through the stages of PCOS. From stage 1, cold and alone at the doctor's office, to stage 5, nailing the PCOS lifestyle, gluten and dairy free. Get ready to finally feel in control of your body again.